Today, we're going to talk about the oral Relugolix for androgen deprivation therapy in advanced prostate cancer. We need to define a few terms. First, prostate cancer. Prostate cancer is one of the most common type of cancer in men. Usually, prostate cancer grows slowly and is initially confined to the prostate gland, where it may not cause serious harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. Prostate cancer that is detected early has a better chance of successful treatment. Now we're going to watch a video that explains prostate cancer in a little bit better way.
Considerations in advanced prostate cancer. Prostate cancer is the most commonly diagnosed cancer among men in the United States, excluding certain skin cancers. A common misperception about prostate cancer is that it is rarely fatal. In fact, it is the second leading cause of cancer-related death among men in the United States. While it is true that prostate cancer is largely curable when diagnosed and treated early, patients with advanced prostate cancer have a less favorable prognosis. Advanced prostate cancer is defined as cancer that has spread beyond the original tumor. The most recent statistics estimate that 3 out of 10 men are still alive 5 years after being diagnosed with advanced prostate cancer. Male hormones, such as testosterone, cause prostate cancer to grow and survive. Early treatments for prostate cancer attempt to lower levels of testosterone in the body. This is known as hormone therapy. However, prostate cancer tumors may eventually begin to grow again, even though levels of testosterone in the body are low. At this point, the cancer is considered to be advanced. Researchers are studying why this occurs to gain a better understanding of how to develop treatments for prostate cancer. Talk to your doctor about questions you may have about advanced prostate cancer. Recent basic science and medical evidence suggest that one possible reason that tumors continue to grow is that they become extremely sensitive to the low levels of testosterone that surround them. In this way, tumors can grow even though there are extremely low levels of testosterone in the bloodstream. Additionally, studies done in both animals and humans show that the tumor may begin to produce its own supply of testosterone. This means the tumor is capable of fueling its own growth. In other words, in advanced prostate cancer, there is evidence to suggest that the tumor may be providing its own testosterone so that it can grow without depending on other sources of testosterone production. Talk to your doctor about new information regarding advanced prostate cancer.
Now we need to define what is the androgen deprivation therapy. The androgen deprivation therapy, also called androgen suppression therapy, is an anti-hormone therapy whose main use is to treating prostate cancer. Prostate cancer cells usually require androgen hormones such as testosterone to grow. Therefore, by suppressing them, we may treat the cancer itself.
The question is does it make a difference which ADT you use? And surely it makes a difference. You can use anti-androgens like bicalutamide, where you have a mild androgen depression, so this is not really complete suppression of testosterone, which is felt, and side effects might mean the testosterone is still within like normal levels. So when you want to achieve a fast testosterone reduction, there are 2 or 3 options. The 2 fastest ones is do a subcapsular orchiectomy, which is complicated to schedule when you have this typical Friday afternoon patient with a PSA of 1,500, hard prostate, and you see in the imaging a spinal cord compression. You really want to have the testosterone down immediately. So one option would be to give a GnRH antagonist to really suppress testosterone within some hours. The third option, but there in this clinical case, to prevent clinical flare, you need to block with an anti-androgen for, let's say, 2 weeks, and then give the agonist, which initially increases the testosterone value and then wears out the receptor, and then eventually results in the same, but it takes longer time. So two options, and in this acute situation, I think the blocker, the antagonist, is the option of choice, and this is what we are going to have discussed in the symposium.
Now we're going to talk about what is the Relugolix. The Relugolix is an gonadotropin releasing hormone antagonist medication which is used in treatment for uterine fibrosis in Japan. It suppresses sex hormones levels to postmenopausal or castrate range in both women and men, with administration once per day. Now we're going to talk about the application in medicine. Relugolix achieved the rapid sustained suppression of testosterone levels that was superior to that with leuprolide, which is another drug used in this type of cases, with a 54 low risk of major adverse cardiovascular events. Now we're going to watch a video about two doctors discussing the use of Relugolix in prostate cancer cases.
Hi, this is E. David Crawford, Editor-in-Chief of Grand Rounds in Urology. Joining me is Dr. Neil Shore. Neil, just several hours ago, you were part of a presentation that involved a phase 3 trial looking at a novel new oral LHRH antagonist, and the trial was called the HERO trial. Could you share with us your view of this trial?
Yes, happy to. These were patients who we accrued in this global prospective phase 3 trial, men with advanced prostate cancer, approximately 934 men, and there was a 2-to-1 randomization for men to receive Relugolix, an oral daily GnRH antagonist medication, in the treatment arm versus the control arm of leuprolide acetate receiving an injection every 3 months. The primary endpoint was week 48 testosterone suppression, and a subset of patients, 184, we looked at testosterone recovery. What we found in the primary endpoint was sustained testosterone suppression to castrate levels, meeting our endpoint, a lower bound of a 95% confidence interval favoring the Relugolix arm. We saw sustained testosterone suppression to castrate levels as a key secondary endpoint in comparison to the leuprolide arm. Additionally, we looked at numerous key secondary endpoints: T suppression at day 4, day 15, T suppression less than 20 at day 15, PSA response of greater than 50% at day 15, as well as FSH levels. And all of the data favored the Relugolix arm, and all of these endpoints had p-values that were less than 0.0001.
Neil, as you know, I have an interest in cardiovascular events that occur with ADT. I noticed in the presentation that there were some differences between the two arms in the study. I wonder if you might comment on those.
We presented the top-level data on the presentation today, and if one looks at the summary of adverse events, and one specifically looks at MACE, or Major Adverse Cardiovascular Events, which is an acronym for non-fatal myocardial infarction, non-fatal stroke, and all-cause mortality. In the Relugolix arm of 622 patients, we saw an incidence of 2.9%. In the leuprolide arm of 308 patients, we saw an incidence of 6.2%. So virtually a half of the number of major adverse cardiovascular events in this prospective trial for the Relugolix versus the leuprolide arm.
Neil, thanks for sharing this important information. We look forward to receiving updates. Thank you.
My pleasure. Thank you very much.
Now we're going to see the pros and cons about this. The pros is that being aware of the results of different investigations, we can recommend to patients different treatments according to their necessities. Therefore, if we know a patient that may need or that have the risk of cardiovascular accidents, we may recommend this type of medication, that Relugolix. Now, to refer to the cons, is that new pharmaceutical treatments will always cause some sort of uncertainty on populations because these are new, that they may not be very confident about them. The article published recently was supported by the developers of Relugolix. Therefore, it may be biased to given the results. Now we need to refer to this issue applied in Ecuador. In 2018, out of 4,292 cases, 18.3% were prostate cancer. And referring to the habitants, 35.6 of every 100,000 habitants suffer from prostate cancer. Therefore, we know that this is a constant problem in Ecuador. Being aware that the Relugolix is a possible treatment for this type of cases, we need to know the different uses and risks and the indications for this type of drug so we can recommend it to patients here in Ecuador. In conclusion, we know that the rapid recovery of testosterone after Relugolix use may be in the clinical relevant for patients receiving intermittent therapy or a short course of androgen deprivation therapy, or patients who want to recover after a complication. Therefore, it's a very recommended drug in this type of cases of advanced prostate cancer.